Hey everyone, today we're going to dig into what happens when the liver, which is basically our body's master filter, just can't keep up anymore. We're going to break down the incredibly dangerous chain reaction of decompensated liver disease. Think of it like a series of dominoes, and we're going to follow them one by one as they start to fall.
And that's a huge question, right? Because a failing liver isn't a localized problem. No, it kicks off this domino effect that ripples through your entire body, causing system-wide failures. In this explainer, we're going to trace that path, domino by domino.
So, how does this whole thing even begin? We're going to start by looking at that exact tipping point, that moment the liver goes from, quietly handling the damage to being completely and totally overwhelmed, which leads to failures you can actually see.
Okay, so it all boils down to one thing really, pressure. Think about it. Years of damage cause scarring, that's cirrhosis, and that scar tissue is like a massive roadblock, just choking off the highway for blood trying to get through the liver. This backup creates a huge traffic jam in the main vein that feeds the liver, a condition we call portal hypertension. And that pressure, that's the engine behind every single problem we're about to talk about.
And this really shows you the two sides of the coin here. On one side, you've got compensated disease. The liver's scarred, yeah, but it's still managing to get the job done. A person might feel totally fine, and the problem only gets picked up on some routine tests. But then you hit the tipping point. The disease becomes decompensated, and that's when the silence is shattered by a full-blown medical crisis, with really dangerous signs like jaundice, fluid buildup, and confusion suddenly appearing. All right, so let's talk about the first big, visible warning sign, jaundice. That yellowing of the skin and eyes, it's way more than just a color change. It's a flashing neon sign that the liver's entire intricate waste management system is breaking down. So to get why this happens, we have to follow this waste product called bilirubin on its journey. Normally, the spleen makes it from old red blood cells. Then it heads over to the liver, which cleverly converts it into a form that dissolves in water so it can be dumped into bile and removed. That process is actually what gives urine and stool their normal colors. It's a really slick, efficient system, when it's actually working. Now, as you can see here, jaundice can pop up for a few different reasons. A problem before the liver, during, or even after. But with decompensated liver disease, we are laser focused on that middle one, hepatic. The problem is the liver itself. The liver cells are just too damaged to do their job on the bilirubin, so this yellow stuff builds up and up in the blood, and that's what causes that unmistakable yellowing of the skin and eyes. Okay, on to the next domino. That incredible pressure we keep talking about, it doesn't just stay put in the liver. It starts forcing fluid to leak out of the blood vessels, and it builds up where it absolutely shouldn't be, in the abdomen.
And here's the crazy part. Your body is smart. It knows there's a traffic jam from the portal hypertension, and it tries to fix it. But its solutions? They backfire, big time. They end up creating a whole new set of even more life-threatening issues. And this is exactly how that backfiring happens. First, that high pressure makes the blood vessels get wider. Then, the body gets confused. It senses this widening and thinks blood volume is low, so it hits the panic button. This triggers a flood of hormones that scream at the kidneys to hold on to every last drop of salt and water. But because of that constant high pressure, that fluid has nowhere to go, so it just leaks right out of the blood vessels and into the abdomen. And that massive swelling is what we call ascites. And having all that fluid just sitting there isn't just uncomfortable, it's incredibly dangerous. It's a breeding ground for disaster. I mean, look at the complications. That stagnant fluid can get infected. That's bacterial peritonitis. The body's hormonal chaos can make your sodium levels totally crash. And maybe worst of all, the kidneys can just give up under all the strain, leading to hepatorenal syndrome, where the liver failure is literally taking the kidneys down with. So how on earth do you manage this? Well, doctors use diuretics, water pills, to try and get the kidneys to flush out the fluid. They can even go in with a needle and physically drain liters of it from the abdomen. For a more direct fix, they can put in a stent called a TIPS to help relieve the pressure. But you have to understand, these are all just holding actions. They're temporary fixes. The only real solution is a new liver. Okay, now we get to the really critical life or death stuff. This is where the pressure and the toxin buildup push the body to its absolute limit, resulting in emergencies where things can go from bad to catastrophic in a heartbeat. So remember that massive traffic jam in the liver? Well, the body tries to create detours, right? It shoves all that backed up blood into these tiny, fragile veins in the esophagus and stomach.
veins that were never ever built for that kind of pressure. We call these swollen veins varices. And if one of those bursts, you're looking at a massive internal bleed. It's an absolute code red medical emergency. When that happens, the response has to be lightning fast and super precise. First thing, you got to replace the blood they're losing with transfusions. At the same time, you're pumping in meds to drop that pressure. Then it's a race against time to get a scope down there, find the bleeder, and literally put a tiny rubber band on it to stop the bleeding. If that doesn't work, you have to move to more drastic measures, like inflating a balloon inside to put pressure on the bleed.
So while all that is going on, there's another crisis brewing. One of the liver's most important jobs is to detoxify the blood. A key toxin is ammonia. Normally, the liver gets it out of there, no problem. But when it's not working, that ammonia builds up, goes straight to your brain, and basically acts like a poison. It causes confusion, what people call brain fog, and it can even lead to a coma. This is hepatic encephalopathy.
And this is where you really see how everything is connected. It's just a vicious cycle. What kicks off this dangerous brain fog? Well, look at the list. An infection from that ascites fluid, a bleed from those varices, even something that sounds simple, like constipation or being dehydrated, can be enough to push someone over the edge because the whole system is just that fragile. So, with all these fires breaking out at once, how in the world do you even begin to manage the chaos? Let's wrap up by looking at the overall game plan for trying to stop this relentless cascade and pull a patient back from the brink. The strategy is basically to fight a war on multiple fronts at the same time. First, you have to go after whatever sparked the latest crisis, the infection, the bleed, the constipation. At the same time, you're giving medications to help the body clear out that toxic ammonia. And all the while, you're constantly providing supportive care, and you're asking the big question, is this person a candidate for the only thing that can truly fix this? And that brings us to the cold, hard truth of it all. You can manage the bleeding, you can drain the fluid, you can treat the confusion, but those are just patches. For end-stage liver disease, there is only one definitive curative solution. Just one: a liver transplant. So if there's one thing to take away from all of this, it's this. Decompensated liver disease isn't a single illness. It's a horrifying chain reaction where every problem triggers the next one. Trying to manage it isn't like treating one thing. It's like trying to stop a line of dominoes after the first one has already been pushed. It is a desperate, relentless race against a cascade that once it starts is incredibly difficult to stop.